Welcome to Tuesday's edition of COVID-19. We've been recording daily cases above 1,000 for the past 2 weeks now. And efforts to contain the fourth wave are being challenged by the heat wave, which is also a plight faced by Iraq. Now, meanwhile, in Germany, torrential rains have triggered frightening floods. Now, we have more on this later on in the program. Here first, Kwon So-ah with the pandemic updates. So, just start us off then.
Sure, Sunny. It's been 14 days now that Korea has been seeing more than 1,000 cases on a daily basis of the COVID-19 virus. 1,278 is the caseload we are seeing as of 12 a.m. this Tuesday, which is the highest ever recorded for a Tuesday. And just like yesterday, domestic transmissions are also standing at above 1,200. So with that, the country has surpassed 180,000 cases in total, and currently there are some 18,000 people in quarantine or under treatment, and out of those, 207 are under severe or critical condition, and it's the first time since early February that that number has surpassed 200. Now, let's go over to a graph now. We are seeing for the second straight day over 1,200 infections, and with that, the daily average in the past week stands at above 1,400 even when we subtract the imported cases. Now, let's move over to our map. A similar number of cases in Seoul and Gyeonggi-do province, close to 400, and there are also concerns here in the center. 73 cases in Daejeon and also down in Busan. Busan and Daejeon have both decided to soon implement level 3 social distancing measures. Meanwhile, the Prime Minister has also asked officials to mull over what to do with the level 4 social distancing measures in the capital region, because the capital region has been under those for more than a week. And here's the Prime Minister with more on what he had to say on the current situation at a government briefing this morning.
Following the adoption of level 4 social distancing in the capital region, the ban on private gatherings of 5 or more is also in effect in other areas nationwide since yesterday. While the situation remains critical, movement hasn't declined by much due to the summer vacation season. Outbreaks outside the metropolitan region are growing, while the reproduction rate has gone up as well.
And that reproduction rate, the Prime Minister just mentioned, stands currently at 1.3, which represents the number of people that one person can transmit the virus to. Also, roughly 1 out of 3 people have recently been infected with the Delta variant, and some 30% of cases are unidentified cases. And what's also standing at above 30% is the number of cases outside the metropolitan region, which is also causing more concern.
Right. Meanwhile, so what is the latest with regard to the outbreak on the Korean naval unit?
I bet you're talking about the Cheonghae unit, Sunny. All 301 personnel on that unit on board the Munmu, the Great Destroyer, are scheduled to arrive in Korea from Africa later on Tuesday evening, that is, following a mass infection of at least 247 people on board. Now, upon arrival, they will have to undergo PCR tests again, and then they will be quarantined or treated at military hospitals. Now, let's get a check on our vaccination figures now. We've got a rise in daily vaccinations. Our Lee Kyung-eun is going to explain who the new people subject to vaccination are, and we've got almost 13% of the nation's population that's now fully vaccinated. Moving over to our international figures now, we've got over 492,800 new infections reported in the past day, and some of the countries that are seeing resurgences are the US here with over 54,000 infections, and also the UK here. Around 60% of people currently recently treated at hospitals have been even vaccinated, but still such a number is being reported. And Indonesia also now became the country with the 14th highest infections around the world. And those are the updates I have for now. I'll see you back after the briefing. Sunny?
All right, so thank you for now. Right, meanwhile, in the local academic arena, inoculations for high school seniors and faculty kicked off earlier on Monday. And for more on this, I have our Lee Kyung-eun here in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right, Kyung-eun, let's start with the vaccinations for those in high school then.
Sure. South Korea began inoculating high school seniors and teachers on Monday. High school seniors are actually the first group of teens in the country to be inoculated. The vaccinations will help them safely prepare for the upcoming National College entrance exam in November. Some 650,000 students and teachers are eligible for this round of vaccinations, and more than 97% of them signed up. Let's hear more from the students and teachers on why they decided to get their shots.
This is a good opportunity as COVID-19 restricted us from going to the cram schools, but because the government let us get the vaccines first, I can go and study harder.
We were limited in our ability to study with friends, but now we can ask each other questions and study in a more comfortable setting.
As we are shooting for the full opening of schools in the second semester, for a safer learning environment, I thought not only just the high school seniors, but also all the teachers should get the vaccines.
High school seniors and teachers across the country will all get the first doses of the Pfizer vaccine by July 30th and their second doses by August 20th. Authorities will also inoculate high school graduates who are retaking the exam in August. Despite the slight differences in schedule, they will all get at least one dose before the mock exam in September.
Right, the mock exam in September. Now, before we move on, Kyung-eun, do remind us about the precautions with regard to the Pfizer vaccine.
Well, Pfizer's vaccine is an mRNA vaccine like Moderna's, and studies show that young people are more prone to developing side effects from these kinds of mRNA vaccines. Heart inflammation is one of those side effects that could occur in rare cases. Common symptoms include chest pain, shortness of breath, or a racing heart. Authorities are recommending students to closely monitor themselves for at least 3 days after getting the shot and immediately see a doctor if these symptoms occur. They are also advised to avoid strenuous exercise for at least 1 week after vaccination. At the same time, however, health authorities say there is no reason to be alarmed because the chances of developing heart inflammation is extremely rare. Also, the cases are often mild and most patients recover fully after a short period of time.
The onset of heart inflammation was typically seen within 14 days post-inoculation, and the condition was most prevalent in young males after their second dose. Most of them, however, recovered quickly after getting proper rest and treatment.
Recipients were also recommended to be on the lookout for any symptoms of anaphylaxis, another known side effect of mRNA vaccines. Anaphylaxis usually occurs within 30 minutes post-inoculation. This is why recipients are being asked to stay at the vaccination site for half an hour so that they can receive emergency medical aid if necessary.
Right. Also, as of the start of this week, those aged 50 to 54 can make their vaccine appointments, I understand.
That's right. And this round of bookings will be divided into 3 phases throughout this week. So on Monday and Tuesday, registration will open for those 53 and 54 years old. And Tuesday and Wednesday, those between 50 and 52. And for the 4 days between Tuesday and Saturday, it will be available for everyone aged 50 to 54. For those aged 55 and 59 who began their bookings earlier and are still ongoing, some 79% have signed up so far. People in their 50s were originally slated to get Moderna's vaccine, but authorities say they will also be using Pfizer's vaccine in light of supply concerns. Take a listen.
To help us react to any supply shortages in a more flexible manner and ensure that vaccines are available to everyone in their 50s, we have also decided to employ Pfizer shots to complement Moderna's, as they are both mRNA vaccines.
The decision was prompted by a delay in the latest shipment of Moderna's vaccines, but health authorities made it clear that the country will be getting all these vaccines contracted for July and August, and that it's only a matter of readjusting the delivery schedule. In a related move, the government has decided to extend the inoculation timetable for those in their 50s. Vaccines for this age group will now be rolled out from July 26th to August 28th.
I see. All right, Kyung-eun, as always, thank you very much for the coverage.
Thank you for having me.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in the local front for this Tuesday. The cap on social gatherings has been extended to regions outside of the capital area. As of the start of this week until the 1st of August, only 4 people can meet up in these regions regardless of their level of social restrictions. And speaking of that, up on the screen is a map showing the different. I understand the briefing is about to start right now, so we'll come back to you afterwards.
I am the director of the Epidemiological Investigation Analysis Task Force, and let us now begin our regular briefing for July 20th. Currently, we are seeing continued rise in the number of daily cases, and in the non-metropolitan area, we are also seeing an upward trend of the new tally. And related to this, as for cluster infections, we have some details. After May, in the regions outside the capital area, we have seen 38 cases, 38 cluster infections, which are related to pubs and bars. And this has infected about 1,000 people, and also most of them were bars of 18, and also some 460 people were infected at these nightlife entertainment venues. And as for these related cluster infections, as a common factor, there has been that some users have been going to these facilities and their office spaces despite having symptoms, and in particular, these facilities also have had poor ventilation. They also, the users stayed in these areas for a very long time despite such a poor ventilation. And when you are visiting these confined areas, which are also prone to infections among the droplets, the respiratory droplets, we ask you to refrain from visiting if you have any symptoms. And if you do actually go to these facilities, also refrain from staying longer at these facilities. And also, if you are managers there, you need to also monitor the users' symptoms and conditions, and also have ventilation and disinfection on a regular basis, and also comply all of the users to have an entry log. And as for the new variants cases, here are some details. Starting from this week, we have seen some the types, and we have been we are going to provide percentages, the proportion of these new variant cases, and this is because we are carrying out these sample testings, and instead of the exact number of new cases, we believe it is better and more effective and more appropriate to have a percentage and the proportion. And during the past week, we have seen 25.1% of the infections among new variants, and also as for the imported cases, we have seen 76%. And also during the past week, as for the confirmed cases, we have had more than 2,000 cases, and we have been carrying out these gene testings, and about 1,500 cases were new variants, and we say that about 52.56% have had the new variants, and the alpha variant accounted for 12%, while about 39% have been accounted for the delta variant, having the highest proportion. And next, as for the critical symptoms of COVID-19, here are some details. Last year in December, we have had the fatality rate stand at about 2.7%. This has been on a steady decrease, and this has also decreased to about 0.4 in June. And as for the monthly fatality rate, we have also seen in the February, this has also been dropped steadily, and also in June, this has dropped to about 2.2%. However, when we look at those who have critical symptoms by their age group, we have been looking at the latest 3 weeks, and as for those above the age of 60, we have seen an this proportion more than half, from 10% to about 4%. And we are also seeing these, taking many things into consideration. We see that there has been a slight increase in the number of fatalities. Right now, we are in the midst of the fourth wave. However, we are able to limit the number of critically ill patients, and we believe that this reason is because our seniors above the age of 60 have been vaccinated. And also, as for the vaccinations, we have more details. Starting from the 26th of July to 31st, we are going to give the Moderna vaccines. However, in Seoul, Gyeonggi, and Incheon, in the capital area, we are going to roll out Pfizer vaccines for these group of people who are between the ages of 55 and 59. And on 21st, we also have Pfizer vaccine doses to arrive in South Korea, and they will be distributed to the capital region. And starting from next Monday, they will be given out to those who have made their bookings for the vaccination appointments. However, as for the Moderna vaccine hospitals, there are about 200 hospitals who have been designated to give out Moderna vaccines. And despite the fact that they are located in the capital area, they will still be giving out the Moderna vaccines. And also, the 43 the companies that are going to roll out their own vaccines will also have the Moderna vaccines, the Pfizer vaccine starting from the 27th. And as for details, we will be providing you the guidelines as soon as we have more detailed information. And as for the booking for the ages of the 50 and 54, we also have in schedule starting from which is currently ongoing, and we believe that at the early stages and early phases of the opening of the reservations, we believe that there could be many people connecting to the servers. So we ask you to refrain from connecting and also making your bookings at these given times. Moreover, as for the people who are not eligible for the booking, we ask you to refrain from connecting and going onto our website so that other people who are eligible for the vaccinations can have easier and access. And starting from the 21st and 24th of July, we will also receive the vaccine booking for all of the people between the ages of 50 and 54. And yesterday, we have also opened the reservation for those between 53 and 54. And as of today noon, we have had about 53.9% of the eligible people making their vaccination bookings. And as for the Pfizer doses, that we also have in schedule about 1 million of doses to arrive in South Korea into an airport tomorrow, the 21st. And we will be receiving 4 million in the month of July, and all rest contracted amounts will come consecutively. And lately, we are also witnessing some people who are seeing a lax in their attentions and precautions against the COVID-19 infections. And here in the country, we have been fighting against COVID-19 for a very long time. Maybe during this course of time, we have been accustomed to the COVID-19 pandemic. However, we need to note that the COVID-19 is very deadly, and we shall not overlook its effects. And it is more detrimental than the influenza virus, and it is more transmissible as well. On top of this, the COVID-19 virus has also higher possibility of developing severe symptoms, and this also goes for those people who are under the age of 60. And as for last week, we have seen about 1.34% of those people under the age of 60 developing critical symptoms. This means that 1 out of every 100 people could be prone to critical symptoms. Moreover, there are also continued research being conducted on the side effects as well as long-term side effects of the COVID-19. And right now, the COVID-19 outbreak here in South Korea is at a very critical juncture, and it is very very much needed for us to minimize physical contact in order to reduce and contain the virus spread. And right now we are at a very grave moment that we need to contain the virus spread here in the country, and we need to refrain from going to crowded areas. Lately, I am also aware that there are many demonstrations and rallies that are scheduled. Regardless of these purposes and characteristics, I sincerely ask you to refrain from gathering at these rallies. And as for the latest trade union rally, we have heard of the news on latest infections in the Gangseogu district, and we are also seeing the possibility of also being these people infected at these demonstrations, and also these people could have been infected at other sources. We do not have the conclusion yet. However, we are also seeing many investigations right now, and we have had the issuance of the administrative order to this end. And as for the PCR testing, we are also very welcoming that members of this trade union have agreed to carry out the PCR testings preemptively. And there are many people, many volunteers, and also many government officials, as well as medical staff who are exerting their full efforts despite the scorching heat. And please give them courage, and please give us your cooperation in order to also encourage them. And right now, seasonally, we are also seeing a very high temperature right now here in the country, and it is very challenging for us to wear our face mask regularly. I fully understand this. Nevertheless, if you are going to crowded areas, you need to wear masks, whether they be dental masks. It is very effective in preventing the infections. And as for the senior citizens of high school and faculty members, we have been giving out the vaccines starting from yesterday. And after inoculation, we ask you to also stay at the vaccination centers for the next 15 to 30 minutes and monitor your conditions. And also, after 3 hours upon returning home, you need to also watch your conditions and as well. And the same goes for the next 3 days after inoculation. If you experience a high fever or also some adverse responses, we ask you to go to the doctor as soon as possible. And 1 week after inoculation, we ask you to refrain from engaging in intensive workout. We will also exert our full efforts. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입 기자단으로부터 받은
Right, so there was Lee Sang-won with Tuesday's afternoon briefing. What did he have to say?
Let's start with the variant updates. There's been some differences in the analysis and the reporting way when it comes to variant infections. Now, according to E, in the past week, around a quarter of COVID-19 infections were tested for variants, which means genetic sequencing has been done on 25.1% of cases, and that's 23.3% when it comes to domestic infections and 70.6% when it comes to imported cases. And so, according to that weekly analysis, out of 2,381 COVID-19 patients, 1,252 had were infected with variants, which is 52.6%. But again, that does not mean that more than half of the nation's population is necessarily affected by the variant, but out of these cases that have been analyzed. And 39.9% of those were the Delta variant and 12.5% the Alpha variant. Also, E mentioned that there have been rising cases at nightlife entertainment venues such as pubs outside the metropolitan region, with some 1,781 cases past May, and that's a total of 38 clusters. And this has especially occurred because people who went to such nightlife entertainment venues went to other multi-use facilities, and that has led to chain transmissions. He also noted that because Korea is currently under a heat wave, that it is difficult to wear face masks, but we still have to abide by that simple rule.
Right, especially when we're within confined spaces.
Exactly.
All right, so thank you for that.
My pleasure.
Right, in this next report, we shed broader light on the fast-spreading Delta variant that looks to derail containment efforts worldwide as it outruns the global vaccination drive. Do take a look.
The highly contagious Delta variant, first detected in India last fall, has now been detected in well over 100 countries worldwide, including Korea. The number of Delta variant infections in countries like the UK and the US have reached fresh record highs over the past month. The UK in particular has witnessed a major spike in Delta variant cases, even after having vaccinated 70% of its adult population. It is now the country's most dominant strain, accounting for 99% of all new infections.
In the last 2 months or so, we've seen a rapid expansion of the number of cases of the Delta variant, and it has outgrown the previous circulating Alpha variant.
According to Public Health England, the Delta variant has shown to be 60% more infectious and twice as likely to trigger serious illnesses compared to the Alpha variant. And the WHO says a person carrying the Delta variant could infect up to 8 people as opposed to 3 for the original virus. The highly contagious nature of the Delta variant aside, the spread of the virus in unvaccinated populations has also been one of the main drivers of the latest surge.
There are vulnerable people who have not been protected properly by vaccination who are now going to be exposed to a lot of virus challenge, either in public transport or in other areas where they're going to be meeting other people.
Over in the US, unvaccinated Americans have borne the brunt of the latest wave, with 99% of recent COVID-19 cases there requiring hospital care coming from those who have not been vaccinated.
Currently in the US, the Delta variant is making up more than 50% of all new cases. Of course, when you have low vaccination rates and the combination of people being more active in society and the lifting of mask mandates, we know that the Delta variant is much more transmissible.
The Delta variant is also tearing through the Southeast Asian region, with health authorities in Malaysia saying the Delta variant is now that country's most dominant strain. Malaysia has imposed a total lockdown, closing its borders and shuttering many businesses to curb the outbreak, but to no avail.
What they are doing now is to expedite further all those public health measures, aggressive contact tracing, screening, as well as isolate those infected. And on top of that, we also expedite, the number of vaccination rate. And at the rate of 300,000 person per day, we hope that we can achieve what we intended for the herd immunity, or at least more and more people will be protected.
Here in Korea, the fourth wave has arrived, with the Delta variant making inroads into the country, accounting for 86% of all imported cases. In particular, the Delta variant is spreading rapidly across the Greater Seoul area.
국내 확진자 중에 주요 변이 바이러스 검출률은 47.1%로 지난주에 비해서 10.2%포인트가 증가하였고, 그중에 델타형 변이 바이러스의 검출률은 10.6%가 증가해서 33.9%가 델타형 변이로 확인되었습니다.
According to a recent genome analysis of around 1,100 local cases, some 70% were identified to be Delta variant infections.
아마도 지금 현재 전파 속도로 봤을 때는 한국도 우세종이 되지 않을까 그렇게 생각을 하고 있고요. 전파력이 좀 약간 증가하는 그런 걸 보여준 것 같고, 그리고 이제 병원에 입원하는 하스피탈라이제이션 같은 게 증가하는 것을 보여주는데, 아마 비슷한 그런 어떤 결과를 국내에서도 볼 수 있지 않을까 그렇게 생각하고 있습니다.
Experts continue to stress that the only way to protect ourselves from the ever-evolving threat of COVID-19 is to get vaccinated and practice rigorous prevention.
개인 방역은 어디까지나 굉장히 중요합니다. 그러니까 변이가 계속 나오긴 하지만 그 변이라고 해서 개인 방역을 이렇게 뚫을 수 있는 그런 특별한 게 있는 건 아니거든요. 그래서 개인 방역을 충분히 하는 게 그걸 굉장히 중요하다고 봅니다.
코로나 상황은 최대 고비를 맞이했고, 본격적으로 폭염이 시작되며 어느 때보다 힘든 여름나기가 예상되고 있습니다.
Nicht ein Hochwasser ist das Beispiel für den Klimawandel. Aber wenn wir uns die Schadensereignisse der letzten Jahre anschauen, dann Jahrzehnte, dann sind sie einfach gehäufter, als das früher der Fall war. Also wir müssen uns anstrengen, sehr anstrengen.
We really saw unprecedented or numbers we have never seen before for severe heat-related illness.
Extreme weather conditions in parts of the globe are further challenging COVID-19 containment efforts. For more on this phenomenon amid the pandemic and its repercussions, I have Professor Chung Ki-seok from Hallym University here in the studio with me. It's a pleasure to have you back, Professor Chung.
Thank you for having me today.
Right then, Professor Chung, before we touch upon the challenges brought on by the weather, let's start with your thoughts on the current COVID-19 situation here in the local front.
Yeah, yesterday we had 1,278. It's a huge number as data from Sunday, because during weekends, people do not go to a hospital or do not go to a screening center for get the lab. So it is very high. And again, we've already mentioned about the Delta virus. The proportion of Delta in our country among whole virus was only 1.5% in May, and it raised to 7% in June, and now it is 34% out of whole virus here. So it is racketeering, and one day we'll see, maybe in 2 weeks' time, we'll see over 50% of Delta virus among whole virus in these countries. That's an amazing one, because that causes more than 2 or 3. So on top of that, we are going through summer holidays, and non-capital area are seeing another increase of recent patients. So we are heading for worse than better.
Right, Professor Chung, the prospects are looking quite bleak. How is the sweltering summer heat, meanwhile, affecting our containment efforts here?
Heat one, right. The heat is very intimidating to us, because KDCA announced a warning sign of heat, because recent 1 week we had 3 heat-related deaths in Korea, and every day 36 patients are reported due to a heat-related disease. So heat causes a heat exhaustion, heat stroke, and etc. So, but it's not the COVID-19 pandemic because of heat, because very hot weather, the virus are not very activated, and the people do not lose their defense mechanism during warmer condition compared to a cold condition. But the heat pushes the people to inside the room, and they are searching for a cooler environment, so they get together and very crowded in an air-conditioned room. So that causes easily spreading of a COVID-19 virus.
Right, especially when these air-conditioned indoor spaces are not properly ventilated.
Right.
Right. Meanwhile, extreme weather events are being marked across the globe, with the summer temperature in Iraq surging above 50 degrees Celsius and deadly downpours in Germany taking the lives of some 200 people. For more on the situations in these two countries, I have Kareem Rashid over in Iraq. Good to have you with us, Kareem.
Thank you, Sonia.
And I also have Alexander Bühler over in Germany. Welcome, Alexander.
Hello, nice to see you.
Right, Alexander, we'll start with you then. Images of the aftermath of last week's torrential rain in Western Germany have sent shockwaves across the globe. What can you tell us about the damages incurred, as well as the ongoing search and rescue operations there?
Well, at the moment, we know that about 150 people have died in these incredible flood waves we've seen. Nobody was prepared for this amount of floods there. And we are we have a big problem there, because it was known that these floods would happen about 4 days before. And now about 600 to 800 people are still missing, and we don't know at which point they will be found, or if some of them are buried in their houses below these incredible mud masses that have flowed there.
Right, it is a very painful story, of course. Kareem, over in Iraq, I understand that power outages are compounding the physical challenges of seeking to endure, that is, the sizzling temperatures there in Iraq. Could you tell us more about this, please?
Yeah, like Iraq, like is one of the countries that is suffering from a lot from the climate change, and also within the coming COVID in Iraq, Iraq is like severely has been like damaged from this, and also like in Basra we had a shortage of the water and poison of the water, and also like we have the significant number of the victim of COVID, and we talking about like the new version, new generation was called Delta, and yesterday it was like 40,870 each only one day, which is significant numbers like compared with the previous numbers and victims. And also we have a new record. Only 12 days child has been victimized with the COVID yesterday, and this boy has been transferred to the hospital to take a be quarantined and also to be treated. So like we're talking about like a very, very significant, severe situation that we are going through.
I see, and we'll get into that in a bit. But first, Professor Zhang, in the early stages of the pandemic, we had a few discussions on the possible impact of temperature and humidity on the spread of COVID-19. What has been shared since then?
Well, I still believe that the temperature and humidity can contribute somehow in spreading the infection. But according to Fudan University, Shanghai in China, they studied related ones, and they reported that either the temperature or humidity did not have any correlation with the occurrence of COVID-19. And also they found that ultraviolet couldn't affect the disease condition. So, but it is conceivable that if you have lower, very cold temperature, you cannot defend the immunity. You cannot defend the pathogen. So if you have a lower humidity, then again your bronchus and your throat cannot defend the virus. But they said they reported that there is no correlation. And also the UV light, ultraviolet, can kill the virus. When the virus are exposed more than 30 minutes to UV light, then the virus can be killed. But they found there is no correlation. These days, if we look at the situation in Indonesia and Vietnam and some Middle East, where they have lots of ultraviolet over there, still we can see lots of patients over there. So if the epidemic is very strong and is stronger enough to penetrate the temperature or the humidity, then these days we are seeing unanimous pandemic here and there, regardless of temperature or humidity. But I can clearly say that if you have a lower temperature in winter and you lower humidity, then you can easily be affected by COVID-19 when you are going through a summer season.
I see. Alexander, back in Germany, against the unfolding tragedy there, authorities in the country, like their counterparts across the world, are also tackling a pandemic. What is the latest with regard to the COVID-19 situation in Germany?
Well, the problem is that we have a rise of cases. It's not as yet as that dangerous. We don't see those many cases yet, but we can clearly, there are clearly indications that we will have in autumn a fourth wave.
Right, I think we're having a problem with the audio with Alexander. So in the meantime, we'll go to you, Kareem. What, Kareem, has been the impact of the scorching heat on efforts to address COVID-19 over in Iraq, Kareem?
Basically, like Iraqi Ministry of Health, given a warning, and also after they saw that there is no solution about this one, and they just depend on the distance and taking some procedures that can protect people, and people will be responsible for themselves. But after this, and they take it out and the quarantine and also curfew, now we are seeing the new Delta, and also significantly is separated now. And in the meantime, we are talking about like the burden of the hospitals. These hospitals, because of the many misadministrations and corruptions, Iraq is going through. And also, like we had the many issues, that political issue and security issue that Iraq is going through. So we don't mention that, and people are suffering from the healthcare, and you are like suffering, and you have lack of like very simple things that is like oxygen for the COVID, the victims. And so the number has been significantly increased in the last, especially this week. And we're talking about the numbers that is like very scary, and also like everyone, including Iraqi ministry, is alarming the will be like the health crisis in Iraq, and that will be like, and everyone will be like bearing in these crises.
I see. And against that backdrop, Karim, I understand that acts of terrorism are also complicating matters, to say the least, in Iraq. Could you tell us a bit about this, please?
I'm sorry, could you repeat again?
The acts of terrorism in Baghdad, I understand a suicide bombing in the market, has everybody very frightened, of course. Could you tell us a bit about the acts of terrorism in Baghdad?
So thank you for reminding me this, because it's very important to be mentioned. And we have like not only like terrorism issues and security issues. It's about like also the militias, like active militias that is from certain countries in neighboring Iraq. This bomb like is like very doubted that we like terrorist attack, but like every election, early elections, these take places. And but like yesterday, there's the Islamic State agreement this attack, and also they signed that. But as an expert, as me, if you are asking me what you think about this one, I will be doubting that ISIS who took responsibility for this one, because if you looking back to the experiences, and also the way that they propaganda is differently with the way they publish it in the social media. But it was like, and the people of Iraq had been the victim of this attack, and it was a suicide bomb. It's claimed to be a man, and it was like the victim, it was more than 39 dead people.
I see. All right, Karim, stay safe, and thank you very much for your time and your thoughts.
Thank you, Sonia, for having me, and it was great.
Right. Meanwhile, we've lost our connection with Alexander because of a weak connection with Germany. So we'll come back here in the studio to Professor Chong. Now, back in the country, Professor Chong, as mentioned by Isangwon during this afternoon briefing, the heat is making face masks quite unbearable. Is there a way to better address this discomfort?
Well, it's very difficult to solve. I find, and anyone find, that the mask is the most effective way to prevent COVID-19. I think it's better than a vaccine, any kind of vaccine. It's my personal belief. So you have to wear a mask anywhere where you go, if you leave your home and until get back to your home. It's a major principle, maybe until next spring in Korea. But if you have, if you can find no one around you, at least 2 meters territory, then you can take off mask outdoors, not indoors. Indoor is mandatory by law, and also mandatory by a medical advice. But outdoors, you can take off your masks. And if you have some people around you, then you can move yourself to some isolated area. Then you can take off your mask. But among many people, you have to wear masks. Then you need to hydrate yourself. So before you leave, then I recommend drink 2 or more cups of water before you leave home. Because among the crowds, if you take off mask and take water, that could cause another chance of getting infected. And also, Korean government developed anti-droplet mask last year. I don't see it's very popular around here, but anti-droplet mask is lighter than KF mask. But then you can use that kind of mask in case you cannot endure KF masks.
Right, and staying with the heat, Professor Jung, healthcare personnel at temporary screening centres are probably bearing the brunt of the blistering heat given their heavy protective gear. Speaking within your capacity as the former head of the KCDC, what are some tangible ways of perhaps easing their plight?
Well, the utmost purpose to relieve their work for them is put more personnel over at front line. So the government promised to put 250 more officers in the front line. But if you divide into more than 200 local governments, it's a very trivial number. But still, you need manpower over there. And Korean government and healthcare center developed several devices like self-isolated screening test booth. The booth has a cooler system in it, and you cannot wear, you don't have to wear protective gear in the booth because it's an isolated one. So, and also they resumed driving through examination. That will relieve the kind of burden. And I would like to recommend a saliva test. A saliva test is confirmed approved by a KDCA, but it's not well used these days. Saliva test, instead of put the bar in your throat, the saliva, if you spit your saliva and put in a vessel, then present to a healthcare center, it is not a bad idea, a bad result. It is 95% correct compared to a conventional PCR test. Then you can relieve whole manpower by doing protecting gears and put the bars in your throat, and you cannot suffer from getting examined.
I see. So that's one alternative.
Yeah, that is one of the detour method to relieve those burdens for medical staffs.
I see. All right, Professor Chung, as always, thank you very much for your insights today.
Thank you.
Right, now do seek to confirm working hours at temporary screening centres nationwide before heading there, as there has been a shift in schedule to reflect the blistering heat. Thank you for watching.